So myocarditis means inflammation around the heart, and it can present as some chest pain, sometimes shortness of breath. Um, and myocarditis is something that can be caused by natural COVID infection as well, and not just myocarditis, but sometimes even more severe disease like heart failure. So I think one of the things that's reassuring is the way that we determined that myocarditis was one of the side effects that can happen from vaccine, and that's through the vaccine adverse event reporting system. This is a national system in the United States that requires all providers to report in when they notice anything unusual that happened after a vaccination. And it's through that system that gets reviewed by doctors to see if it's what would be expected in the general population or if it's different, that we can learn if there might be an effect from vaccine. So myocarditis was one of the effects that was noted with mRNA vaccine, primarily among men more than women and in younger adult males. So it's not something that's affected the entire population equally. Where we have seen it with vaccine, it's been relatively short-lived and most recover fully. So it's a little different than what we see with natural infection. And Dr. Ching has actually cared for people who've had myocarditis after natural infection and after vaccine. I wonder if you could speak a little bit to what you see with those two scenarios.
Yes, it is true that the myocarditis can be seen after the vaccine and after natural COVID infection. But what we do know is that the milder cases after the vaccine were usually after the second dose within the first 7 days. And those symptoms are short-lived. The children were recovered and they recovered by, a month from their presentation. Children that have COVID-19 myocarditis from an actual COVID infection have more severe illness and have much more concern about long-term side effects.
So it sounds like if you're worried about potential side effects from vaccine, actually you should be more worried about the effects of getting COVID itself.
Correct. That is what we are worried, and we have been seeing throughout this time where we've had more information coming out that the acute myocarditis from the COVID infection is more severe than the side effect.